Welcome to this module on the nervous system. We've talked about a number of systems in the body, but this is probably one of the main systems that we impact as a sports massage therapist. So we're going to talk about what the nervous system is, what its functions are, and I want you to start considering what might be going on when we're working with our clients, and how touch is our pathway to communicating with our clients' nervous systems. The nervous system has many functions, and it, along with the endocrine system, are the control houses of the body. 6 key functions, starting with it receives information, various sensory inputs, for example, things like temperature, pressure, but also things more internally. For example, hormone levels, heart rates. It then processes this information. What does the information need? What does it mean? What do you need to do? And that leads to function 3 and 4. It also sends information and can trigger actions based on that information as the output. It can send information. For example, it can send a motor signal to tell you to remove your hand from a hot pot after receiving the heat as an information when you touched it. So it takes these inputs and creates outputs once it has processed it. And this happens automatically. For example, you're not aware of many of the inputs your brain receives, or the outputs. Things just happen automatically. And that's what we call autonomic function. But on the other hand, we have somatic function or conscious function. And this is things like you deciding to speak, deciding to take an action, deciding to run for a bus. And the nervous system is also responsible for regulating key body processes. Things like heart rate, digestion. Lots and lots of the processes we've talked about in the various modules in our anatomy and physiology are controlled by the nervous system too. The nervous system is made up of 2 divisions. The first is the central nervous system, the brain and the spinal cord. And then we have the peripheral nervous system, which describes all of the nerves that leave the spinal cord. And this has 2 subdivisions. Firstly, the SNS or somatic nervous system. And this is for all of the conscious control that we have in the body. For example, the controlled movement of skeletal muscle, that contraction, relaxing, allowing us to move. And then we have the autonomic nervous system, or the ANS. And this is largely for subconscious or unconscious control, things like heart rate, breath rate, and digestion. So the central nervous system is made up of the brain and the spinal cord. It constantly receives information from the peripheral nervous system about both internal and external environments. It's often to think intuitively of the external inputs like heat, pressure, the situations that we find ourselves in, the sounds we hear, the things we touch. But it's also responsible for receiving information for the internal, so what's going on within the body. It collates and processes that information, and that allows it to make decisions very quickly on what action should be taken. Those actions could be integrated with other systems, like to speed up heart rate, breath rate. Or it can also be to work consciously, to help us decide to move, for example, to run away from a dangerous situation. So it initiates instructions and outputs for bodily activities. And this can be done very quickly. It's a very responsive system. So now we're going to look at both branches of the peripheral nervous system, the PNS. Firstly, let's look at the somatic nervous system. And this is concerned largely with changes from the external environment. So those sensory nerves picking up those things external to our body. Things like touch, heat, movement, sound. It's under conscious control, and it processes this information, and we make conscious decisions of what action should be taken. For example, seeing a dangerous situation and running away, so consciously controlling those movements to run away. Touching a hot pot, feeling that heat and knowing from experience that this means there is danger or damage will be done to your hand, sending pain and removing your hand from the pot. So the pain is an output to the brain to protect you, and based on the input of that pain, you also decide to move your hand before you get burnt more seriously. So it's around conscious control, sensing inputs, processing those inputs, and then sending some outputs. We then have the autonomic nervous system, largely concerned with our internal control. So sensing what's going on in the internal environment. So things like hormone level, how our organs are functioning. Controlling the smooth involuntary muscles, like the heart or the digestive tract, for example. Working and integrating with the endocrine system to engage glands to secrete more or less hormones. So these are all things that we don't think about or control consciously. They're happening continuously on an ongoing basis internally and under subconscious control. So the PNS, this autonomic nervous system branch, has two types of efferent nerves, sympathetic and parasympathetic. And we're going to look at these in detail now, as they go some way to explaining some of the presentations that we see of clients in clinic, but also go some way to helping us understand how manual therapy and movement might be helping our clients. The sympathetic nervous system. So its primary process is to stimulate the body's fight or flight response. However, that sounds like it's only activated in very extreme situations, and this is not the case. It needs to be working on a consistent and constant basis to maintain a basic level of homeostasis. For example, it helps us prime our body for action in the moments before waking, forgetting about our daily lives, exercising, maybe competing. So it's something that we use all the time, but can also be engaged in more extreme stress-based situations. So what does it control? When our sympathetic system is engaged, our pupils dilate, it inhibits salivation, it relaxes the bronchi and accelerates the heartbeat. So it helps us to breathe and our hearts to beat at a quicker rate to get more oxygen to the body. This primes us for movement, for example, to run away from a dangerous situation. It inhibits peristalsis and secretion, which has a knock-on impact on digestion. Again, this is about getting blood and oxygen to our muscles for movement, for action, rather than for resting, restoring, and digesting. It stimulates glucose production and release, and secretes adrenaline and noradrenaline. It inhibits bladder contraction, but it also stimulates orgasm. So the sympathetic system is not a bad thing. It is something we absolutely need. But if overstimulated, then it can be a significant factor in conditions like adrenal fatigue, headaches, high blood pressure, heart disease, anxiety, and more. So like with everything in the body, it's about balance. And it's about a sympathetic nervous system that's working as desired and to support our well-being. We then have the parasympathetic system, so the opposing system to the sympathetic system, where we go from fight and flight to rest and digest. So this is the state of rest and relaxation, of non-threat in our body. The pupils constrict. It stimulates the flow of saliva, so priming us for eating and digesting. It constricts the bronchi and slows the heartbeat, so slowing us down to rest and to focus on restoring and digesting. stimulating peristalsis and the secretion of the digestive enzymes, and stimulating the release of bile. Contracting the bladder is also controlled under parasympathetic system. So this is the system of no danger, of being allowed to rest and digest and do things like eat, sleep, urinate, and digest food. So we have our sympathetic system, fight, flight, go, and then we have our rest and digest system. So how does all of this communication and processing happen in the nervous system? And how does it happen so quickly, millions and millions of times in the body? And it's via this network of neurons. There's a large number of nerve cells in the body, or neurons, and they're electrically excitable cells that both process and transmit information by electrical and chemical signaling. Now, two types, as we've said. Afferent or sensory neurons. These are specialized cells that carry the sensory stimuli from the environment. So they tell us how much temperature, what the temperature is, what pressure, what light, what we're hearing. So they sense information and send it to the central nervous system. And then we have efferent neurons or motor neurons that carry the motor commands from the central nervous system to the target cells. So, for example, the message to contract a specific muscle fiber. So let's look at the structure of the neuron. They all consist of a cell body, many dendrites, an axon, a node of Ranvier, a myelin sheath, and axon terminals and synaptic terminals. So what do each of these elements do? So let's start with the cell body, which is here in the diagram. So it contains a nucleus that contains the DNS of the cell. So it regulates the function of the cell, or the cell's activity. The cell body is also called the soma, and it produces all of the proteins for the dendrites, axons, and synaptic terminals. Dendrites. These are the branched projections that you see in this image. And they act to propagate the synapses received from other neural cells to the cell body. They receive information from other neurons and send those messages to the cell bodies. So those branches reach out to communicate. The axon. The axon is a slender projection of the nerve cell, and it's what typically conducts the electrical impulses away from the neuron cell body. We then have the node of Ranvier, which we see located here. So this allows the nutrients and waste products to enter or leave the cell. It allows nerve impulses to move along the neuron through the process of depolarization and repolarization of the nerve membrane. They're uninsulated and they're highly enriched in ion channels, allowing them to participate in the exchange of ions required to regenerate the action potential. Next, we have the myelin sheath. So the myelin sheath is a fatty sheath that covers the axon, and it acts as an insulator so that electrical messages can be sent quickly and easily. It is essential for the proper functioning of the nervous system. We then have the synapses. So this is a structure that contains hundreds of sacs that contain different chemicals called the neurotransmitters. These permit a neuron to pass an electrical or chemical signal to another neuron. So let's touch briefly on pain, as we cannot talk about the nervous system without touching on this subject, as most of the clients who come to see you will have some level of pain or will have had some level of pain in the past. So what is pain? Pain is an output from the brain, always. That doesn't mean it's not real, that it's in your head. It is very real, but it is an output from the brain.
always. So pain is a protective mechanism. When our brain receives inputs that it deems to be or to present danger, it may output pain as a mechanism for us to protect ourselves. For example, putting your hand on that hot pot, your inputs are the heat, the vision of the boiling pot, knowing that it's hot, past experiences of touching hot things. And your brain wants you to remove your hand before the burn becomes more serious. If we didn't have pain and we're busy, we might not realize that we're doing damage to our hand. But we get that short, sharp, acute pain which tells us there's danger and makes us remove our hand more quickly. So it's a protective mechanism. But pain doesn't necessarily mean there is damage in the tissues on a pathological level. Equally, you can have damage. There can be damage, but there can be no pain. So pain is a complex subject, and we will talk about this in a separate module on pain science towards the end of your course. But let's touch on the different types of pain, as this will make sense when we start looking at things like the biopsychosocial model as to why pain differs in different people. Pain is complex. No one definition fits each person because every person experiences it differently. So nociceptive pain is pain where there is damage to the body. That's stimulation of peripheral nerve endings. It can be sharp, acute, throbbing type pain. We then have neuropathic pain, and this is caused by actual damage to nerve endings. Nerve pathways that are damaged can be felt as painful. So this could be caused by an infection, for example. Psychogenic pain is pain associated with psychological factors, where there isn't damage, for example. So pain can be caused by prolonged mental, emotional, or behavioral factors. It can be things like headaches, stomach pain, back pain, muscle pain. Sometimes this type of pain can be quite damaging to someone who's in pain, as they may believe that it means it's not real, that it's in their head. And this is where it's important that we explain what pain is to our clients, that pain is always an output from the brain, and that there are ways and means to help manage all types of pain. But the body also has some natural painkillers, things like endorphins, serotonin. And we know that all of these types of pain love movement. Movement helps to alleviate all of these types of pain. And we'll also see how manual therapy and massage can also help relieve pain.
So let's talk about some pathologies of the nervous system that your clients may present with or may have a previous history of. So let's start with a stroke. So what is a stroke? So the brain, like all the other organs in the body, needs to have oxygen and nutrients brought to it by circulation. So if there is a restriction in that supply of blood, well, those nutrients and oxygen is restricted to the brain and cells begin to die. So stroke can lead to serious brain injury, disability, and even death. So in terms of identifying a stroke, and you will learn this when you do a first aid course as well, it's identifiable and actable by the acronym FAST: face, arm, speech, and time. So face, the face may have dropped to one side, they may not be able to smile, or an eye may have drooped. Arms, so the person with the suspected stroke may not be able to lift both arms and keep them there because of arm weakness in one arm or numbness. Their speech may be slurred or garbled, not make sense. And time is the last factor. So the longer the stroke goes on, the more damage, the more brain cells die. So ring 999 and act fast. So what does this mean? So if someone has a stroke, you will apply a first aid. But if someone comes to you with a history of stroke, so massage is contraindicated in the first month following a stroke because there's a high risk of a second stroke during that first month. So massage, an absolute contraindication in the first month. There's a lower risk of stroke occurring up to 6 months after the first. So if your client is within 6 months of having a stroke, please ask for medical permission before treating that client. Post the 6-month stretch, then massage is indicated. Next up is a transient ischemic attack, sometimes called a mini stroke. So this is I suppose, a mini stroke or a mini event where the person recovers with little or no damage. It can be caused by clots in the vessels of the neck rather than clots in the head. The disruption in blood supply results in a lack of oxygen to the brain, and that can give sudden similar symptoms to a stroke, such as speech or visual disturbances, numbness, weakness in the face, arms or legs. So similar but generally shorter in length. In terms of massage, there's generally, if someone's had a TIA, a transient ischemic attack, then there is a high risk of further TIAs. So medical advice should be sought before giving someone a massage. Epilepsy. So epilepsy is caused by abnormal electrical activity in the brain, and this can be anything from momentary lapses in attention to major seizures and fits. Again, your first aid training is key, so if a client ever has an epileptic fit or a seizure, you know how to respond. But in terms of treating clients with epilepsy, there's no research that shows that massage is negative, but it is advisable to seek GP input, as every client is different, the frequency of their seizures and the severity. So please seek medical permission before treating that client. So Parkinson's. So this is a progressive disease and it's degenerative in its nature, and it's caused by degenerative abnormalities in the brain. It's characterized, and symptoms include tremor or shaking in the hands and limbs and stiffer, slower movements. It can also bring on anxiety, depression and sleep problems as side effects. So for a client with Parkinson's, massage is indicated, but under medical supervision. So please seek GP approval first, but it can help maintain flexibility and reduce some of the anxiety and sleep problems that are associated with the disease. So sometimes people who suffer from Parkinson's usually have restricted movement, so they may not be able to get onto the massage table, or set it low if you do have, so that it's easy for them to sit on it and get to a lying down position. Other options are to work in a chair and do seated work with that client, but always ensure the feet are grounded. Next up is ME, myalgic encephalitis. And this is also known as chronic fatigue syndrome, and it results in fatigue and general aches and pains in the muscles of the body. It can also include sleep problems, poor short-term memory, and difficulty focusing. It has a long list of other associated symptoms, and its exact causes are unknown. There's theories that it could be post-viral, so for example, post-glandular fever, there seems to be an increase in number of people who suffer from this condition, or that even bacterial infections could trigger chronic fatigue syndrome. So massage is indicated in the subacute stages. If someone's in a fatigue flare-up, then massage is probably not the best thing for them. Also, different clients react differently to massage. Given that massage works with the nervous system, it can be quite draining for a client with ME. So err on the side of caution when it comes to pressure and also duration of hands-on work. Your client, especially the first time they've come, you don't know how they will react. They could be quite fatigued, and some people even report being knocked out for days in terms of exhaustion. So ask your client if they do have this condition, and it's a long-term condition. Have they had treatments before? What types of treatments? How long were the treatments? And how did they react afterwards? And this will give you some idea. If not, negotiate on pressure and duration. So multiple sclerosis is an autoimmune condition. And so an autoimmune condition is where your immune system mistakes part of your body for a foreign pathogen or substance, so it attacks it. So in the case of MS, and it's linked to the nervous system, is that it attacks that myelin sheath, that lining that we talked about in the brain, spinal cord or nerves. And this is the layer that surrounds that outside of the nerve, protecting them. And it's also what helps those electrical signals travel quickly and easily. So those kind of things we do without thinking, the things that we do quite frequently. So in MS, in terms of symptoms, People will have fatigue, vision problems, numbness, tingling, some muscle spasm, stiffness, weakness, or issues with mobility. Massage indicated in the subacute stages when the client is in remission. Peripheral neuralgia or neuropathy. So this is numbness and tingling in the feet or hands, so in the peripheral, the limbs. It can also be accompanied by burning, stabbing or shooting pain in the affected areas. Loss of balance, coordination and muscle weakness, especially if that neuropathy is in the feet. So in terms of cause, so for example, in the UK, diabetes is the most common cause of peripheral neuropathy, although there are some other causes. In the case of diabetes, the high blood sugar levels damage the nerves, and this type of nerve damage is known as diabetic polyneuropathy. Peripheral neuropathy can also have a wide range of other causes. It's just less common. So for example, physical injury to the nerves, virus infections such as shingles, or even the side effect to certain medication can lead to peripheral neuropathies. So modify your pressure. So massage is absolutely indicated, but if someone does have reduced feeling, some numbness or tingling in that part of the body, then they cannot report back to you in terms of pressure. So always err on the side of caution. Less is more when it comes to these clients. Nerve impingements. So you may have a client come to you with a diagnosis of a nerve impingement. For example, the AC, acromioclavicular joint impingement. We talked about that in the joints module, along with other things like sciatic impingement at the lumbar spine. Again, we would never diagnose these conditions, but people will often come to you. They may have been recommended soft tissue work to help relieve some of the symptoms of those conditions, or your client may have a history of those conditions. So what exactly is it? So it's where the nerve gets trapped against harder tissue like bone or cartilage, for example, where a disc might protrude onto a nerve in the spinal cord. So the symptoms can range from pins and needles to numbness, tingling and pain, and in extreme cases loss of muscular function as well. So often the muscles contract protectively around the pain, so there can be a lot of compensation patterns and soft tissue work that needs addressing in clients who have a history of nerve impingement. Again, modify pressure. If the client has some numbness, tingling, it may be that they cannot report back accurately on pressure, so less is more. So sciatica, so here is one very common nerve impingement, and this condition refers to pain along the sciatic nerve, where the nerve is getting entrapped somewhere along its journey. So most commonly, you will see this in the lower back. So someone may have a disc that's protruding and impinging on a nerve, or compression in their lower back, and other conditions that result in this impingement of the sciatic nerve. And often it's quite common that it can be entrapped below that point. So for example, tight muscles in the hip, so things like piriformis syndrome, where you're getting an impingement of the nerve due to soft tissue impingements. So not only is this a bony impingement or a nerve impingement at the spine, it can also be caused by muscular spasm. So massage is indicated for sciatica due to the muscular and ligamentous causes, and it's really good at desensitizing tissue, reducing tone in the areas where that sciatic nerve may be impinged. For spinal causes though, massage can be helpful when it's non-acute to help alleviate the pain and spasm. But if your client presents with acute sciatic symptoms, please refer them to a physio, osteo or GP for diagnosis or for further treatment. So what does all of this mean for massage? Well, there are a wealth of studies that show that massage can be used to manage pain across chronic pain, post-surgical pain and even acute pain. Massage is good for pain. It creates these small windows of pain reduction or creating pain-free windows that can help get your clients moving. Movement, strength work, really key to long-term results. But massage can often be that first stepping stone to getting the pain to a level where your client can move and feels confident to move. Research actually shows that a moderate rather than light pressure elicits a response from the parasympathetic system. So again, we'll talk about layers of pressure on the course. Layer 1 being, that's nice, I'll fall asleep. Layer 3, I'm going to run away. Layer 2, I can feel that, but it's not taking my breath away. That's where we want to be. We want to know our clients are there. Our clients want us to know that we're there with them, but we don't overwhelm them and we don't create pain. Massage also has a role to play in the relief of the symptoms associated with nerve impingements, so reducing spasm, tone and pain in the associated muscles. And even studies on MS patients show that massage can be helpful in relieving the stress and anxiety associated with the condition. But it's also been shown that massage can help reduce the pain, improve the balance and increase walking speed in clients with MS. Again, we don't know why massage helps reduce pain, but the current hypothesis and model that we're working to is that it creates a response from the nervous system. We change through our touch a protective mechanism within the brain to being one of safety, so reducing that pain. So remember, get your clients to breathe slow, don't overwhelm them, and absolutely don't push them into pain or breath holding with your treatment.